As I work in the medical intensive care unit, I have decided to discuss with you a couple of the more common antibiotics that are used for the treatment of pneumonia within our institution. As you may know, pneumonia is an infection of the lower respiratory tract. It is caused by viruses, fungi, protozoa, and parasites. The virus destroys the ciliated epithelial cells and invades the goblet cells and bronchial mucus glands. Sloughing of the destroyed bronchial mucus glands and sloughing of the bronchial epithelium impairs the mucus clearance by the cilia. This then leads to the consolidation of the alveoli and therefore the pus formation. Cefotaxime is an antibiotic that is used in the treatment of infections caused by bacteria such as with pneumonia and is a third-generation cephalosporin antibiotic that has broad-spectrum activity against both gram-positive and gram-negative bacteria. It is a bactericidal agent and acts by inhibiting the bacterial wall synthesis. Cefotaxime is resistant to the potential action of enzymes such as beta-lactamase enzyme as a result of its chemical structural modifications. Drug interactions that are most important are that of amikacin, NSAIDs, and warfarin. The drug efficacy of ceftriaxone over multiple studies remains to be about 95%, leading it to be one of the primary use lines of treatment in infections. It should be avoided in the treatment of neonates as well as the geriatric population being treated with calcium. As liver concerns are also present, those patients with hepatic disorders should use this medication cautiously. When seeing a doctor for possible treatment, the client must be forthcoming about all medications, including vitamins, and their past medical history. An important note is that calcium infusions should not be given to a patient within the 48-hour time period of the administration of cefotaxime. In rare occurrences, this medication can cause seizures and should be notified promptly. Without insurance, the average cost of a vial of ceftriaxone is about $15 to $16. In the U.S., the course of treatment may cost roughly about $100 to $200. Unlike its counterpart of ceftriaxone, that can be given once daily, cefotaxime necessitates 2 to 3 doses daily. This medication is administered intravenously or intramuscularly and is metabolized by the liver and excreted out by the urine. Expected outcomes of this medication is that the bacterial cells are unable to multiply by the breaking down of the cell walls and synthesis, allowing the immune response of phagocytosis to occur. Another medication that is commonly utilized in the treatment of pneumonia is ampicillin. Ampicillin is a semi-synthetic derivative of penicillin that is given orally and is a broad-spectrum antibiotic. Like all antibiotics, it is not useful in the treatment of viral infections. As this medication has been in use since 1961, it is on the World Health Organization list of essential medications and is listed as highly safe and effective in the treatment of bacterial infections, while also being extremely affordable. The average cost for a 10-day treatment is only $13. The mechanism of action is the bactericidal activity through the bacterial wall synthesis by the binding of penicillin binding proteins. Ampicillin is used for gram-positive bacteria and inhibits the last stage of the bacterial wall synthesis. Drug interactions include allopurinol, contraceptives, and atenolol, along with PPI medications, which will decrease the ampicillin efficiency. Although the FDA has no indications of harm to pregnant women, all precautions should be made. Like any other medication, prior to delivery, the patient should disclose any past medical history and other medications that they are taking. Specific mention is made in all of the research that I have made for those with mononucleosis to not use ampicillin in the treatment of bacterial infections, as it can cause extensive harm to the kidney that's already under duress. In order for antibiotics to work, they must accomplish 3 tasks. First, the antibiotic must bind to its target site, penetrating the outer membrane, and avoid being pumped out of the membrane and remain intact as a molecule. Second, it must bind and occupy multiple binding sites. And third, it must remain long enough to allow sufficient time for metabolic process of the bacteria to be inhibited. And there you have it.